For our overhead squat assessment, from the anterior view, we're going to begin by looking at the feet. When one squats, their feet should be able to stay nice and straight. The common compensation that we see is the feet turning out. So for Claire, we'll go ahead and line her up, 5 kinetic chain checkpoints. Feet, knees, and hips are nice and neutral. Neutral position there in the hips, and shoulders are down and back. Now we'll ask her to reach both of her hands all the way overhead. Now from that anterior view, we're only going to look at the feet and the knees. We'll ask her to squat 3 to 5 times, about to the height of a normal chair. What we can see there immediately is that her feet start to turn out. We'll ask her just to do one more, and you can go ahead and relax. If we can see the compensation, there's no reason to continue making her squatting. We see her do it, and then we'll just move on from there. Now the muscles that are overactive whenever the feet turn out are the lateral gastrocnemius, the short head of the biceps femoris, and the TFL. Now let's identify those muscles. If you wouldn't mind turning around for me. So whenever we look at the overactive muscles here, when the feet turn out, the overactive muscles, or the muscles which are doing too much, can be identified as the lateral gastrocnemius. Now the lateral gastroc is positioned here. We have the lateral and the medial head when we look at the gastrocnemius. It crosses both the ankle and the knee, and whenever the knee is slightly bent, so go ahead and come into a small squat there, what we see is that lateral gastrocnemius can help to externally rotate the tibia, which is turning the feet out. In addition, we have the short head of the biceps femoris, which is positioned here. It attaches out to the fibular head and comes up about 1/3 of the way up the thigh. And again, as we go into this squat, if it's overactive, it can turn the foot out. And go ahead and stand, and if we could turn and face back towards the camera. In addition, one that's oftentimes left out is the TFL. Now the TFL sits up here near the hip, but what we need to understand is that it attaches to the IT band, and that IT band comes all the way down here and attaches to the front part of the tibia. So if any of those muscles are overactive, which simply means they're doing more than they should, whenever we squat, it will start to turn the feet out. Now the underactive muscles, the muscles that are normally not doing their job, are usually just on the other side of the joint. So with that, we would see the medial gastrocnemius. If you could go ahead and spin around for me again. The medial gastrocnemius is going to be here on the inside. So it's the other side of the joint in the transverse plane with the knee rotation. We can also see the medial side of the hamstring becoming underactive, and the glutes can also become underactive. You can go ahead and spin around again. So whenever we see the feet turn out, the areas we would need to foam roll and stretch would be the lateral gastroc, the short head of the biceps femoris, and the TFL. The areas we would need to activate would be the medial gastroc, the medial hamstrings, and the glutes.